In the summer of 2021, the Delta variant of COVID was driving hospitalizations back up, despite the fact that the COVID vaccine had been available for some time. Of particular concern was the hospitalization numbers from Israel, where a very high proportion of the overall population had been fully vaccinated, nearly 80%. The concern came from the fact that during that summer, nearly 60% of the patients that were in the hospital with severe cases of COVID were vaccinated. People took this to be evidence that the vaccines were not effective against the new Delta variant. However, a careful statistical analysis shows that this is the wrong conclusion to draw. But how can that be, given that nearly 60% of the hospitalized cases were patients with the vaccine? One thing the statistical tools of science can be used for is assessing risks associated with different behaviors. Using available data, we can quantify the probability of certain outcomes given certain choices we make, and calculate risk factors for any number of different scenarios. We can draw inferences about causal relationships from this data. However, we do need to take care when performing analyses like these, because sometimes the statistics can look very different based on how we group individuals. We can see this at work in the data about COVID hospitalizations in Israel. The rates of hospitalization for vaccinated and unvaccinated Israelis suggested that the vaccine's efficacy had worn off rather quickly. Needless to say, people were alarmed at this prospect. However, a closer inspection of the statistics showed that this was an example of Simpson's paradox, where the statistical picture that appears for the whole population is exactly the opposite of what you see when you look at the statistics for the groups that make up the population. Therefore, the causal conclusions that we draw from the data are wrong. Here's how it worked in this case. The issue is that the proportion of the population that had been vaccinated was much higher than the proportion that had not. Over 5.6 million people had been fully vaccinated, and only around 1.3 million people remained unvaccinated. When you take that fact into account, the number of cases of patients hospitalized with severe COVID tells a different story. Yes, there were more people, 301, who had been vaccinated yet still had severe cases of COVID. But they were coming from a much larger segment of the population. Out of the 5.6 million people who had the vaccine, those 301 were a very small proportion, only 53 per million. The smaller number of patients who were in the hospital with a severe case of COVID and had not been vaccinated were drawn from a much smaller segment of the population. Out of those 1.3 million people who did not get the vaccine, the 214 hospitalized patients represented a much larger proportion, though still quite small, 164 per million. Despite the fact that the proportion of severe COVID cases that had the vaccine to severe COVID cases that did not have the vaccine was high, when the data is appropriately contextualized, we see that it was still 3 times more likely that a person would get a severe case of COVID when they weren't vaccinated. But that's not even the full story. When the data is broken down to account for age, an even more accurate picture starts to emerge. As it turns out, the unvaccinated segment of the Israeli population tended to be much younger than the vaccinated population. Young people had been told that they were at less risk from COVID, so they were more likely to skip the vaccine than the more vulnerable older population was. When you consider the rate of hospitalization of the different groups and you account for age, you see that staying unvaccinated, especially if you're old, was much more dangerous. In the age group over 50 years old, there were around 2.1 million Israelis who had been vaccinated. Out of this group, 290 were hospitalized with severe COVID, which is a rate of 136 per million. A very small number of Israelis over 50 did not get the vaccine, around 186,000. But out of this group, 171 were hospitalized with severe COVID, which is a rate of 919 per million. That means it was nearly 7 times more likely for someone over 50 to end up hospitalized with severe COVID if they had not been vaccinated than if they had been vaccinated. And in the younger population, the difference was even more stark. It was 13 times more likely to be hospitalized if you had not gotten the vaccine, though the numbers of hospitalizations were still very low for younger people. This is a really illustrative case of how there can be hidden variables in a statistical analysis that can substantively impact our understanding of the data. Despite the fact that the numbers of hospitalized patients who had and had not been vaccinated suggested that the vaccine's efficacy was low, a more careful analysis shows exactly the opposite. The causal picture was different than what the data suggested. It seemed like vaccination did not cause resistance because of the high numbers of vaccinated people who had severe cases of COVID. But it turns out that age and base rate of vaccination in the population were confounding variables. Accounting for these showed vaccination did cause increased resistance.